Congressman Peter Welch, who joins me on the telephone from Capitol Hill. Welcome, Congressman.
Good to be with you.
Thank you for being with us. Now, this repeal vote is going to go ahead. The Republicans look like they have the votes they need. So what can Democrats do?
Well, we can fight it. I mean, we've got to take a stand and defend the health care provisions in there that make a big difference to the American people. You know, the Republicans, give them credit, they beat us good in the campaign. They ran against health care. They said they were going to repeal it, and now they're doing it. But we've got to point out what is in it, because they've decided to do this wholesale repeal that includes things that are wildly popular, like insurance reforms, and they're trying to act as though that is not going to have an impact on real people, real families in their district and in mine. Let me be specific. Under current law, if you have kids getting out of high school that get an entry-level job, $10 an hour, that comes without health care. You can be on your parent policy. Or if you've got a sister who's got cancer, you can help her buy insurance and not be denied because of her pre-existing condition. Or your folks, let's say, really trying hard to take care of themselves, they're on Medicare, they get free preventive care. And if we're going to bend the cost curve, everybody says you have to have access to free preventive care so you get that cancer screening.
So, Congressman, let me just, before we delineate the rest of what's in the bill, but what actually can be done other than listing these provisions to stop what the Republicans are going to be doing next week?
Well, my view is we've got to make them own the consequences of what it is they're doing, and there are real consequences. See, what's happening, as I see it, is that they ran against Obamacare. That meant a million different bad things to a million different people. But if you get specific, and now really we're beyond the campaign, and it's policy that is going to have consequences, and I think the Democrats have to defend those provisions particularly that have such popularity across the country. And a lot of those center on the insurance reforms that were long-sought victories by the American people. What is happening with the repeal is that you're literally throwing all of those out, and you're turning the keys back to the insurance companies. And as people get to know this in its reality, as opposed to simply an Obamacare epithet in the of the campaign, they're going to start asking themselves questions about what it is the Republicans are doing, whether what they're doing is radical and irresponsible.
Today, Congressman John Boehner was sending around, or his office anyway, was sending around a new Gallup poll that says 48% of the country would like health care to be repealed. There's only 40% that wants it to stay. So what do you do in the face of those numbers? You've also said that the Democrats did a lousy job selling health care during the process of putting it together. So how do you change those numbers around?
Well, 65 of us proposed amendments to the Rules Committee, where we were asking for an up or down vote on many of the different provisions in the health care bill. And the Republicans have promised that they will give us open rules so we can have up or down votes, and now they're having a closed rule so that we're not going to be given that opportunity. But my goal is to continue to point out that, hey, if we repeal it, it means we're not given an opportunity to let our voters know where we stand on the pre-existing condition question, the free preventive care provision, and so on. So the Republicans have the power, they have the might, but that doesn't mean we should just roll over. And I think the more we focus with laser-like intensity on some of the concrete provisions that are broadly popular, it's a different question for people. Do you want to repeal Obamacare? A lot of people say yes, because it has some abstract meaning to them. Do you want to let insurance companies deny you because of a pre-existing condition? Overwhelming opposition.
Let me ask you a question, Congressman, about this power point you made, which is that Republicans do have the power. And yet, Speaker Boehner, in his big speech, said that he could promise the minority openness. So he promised, on the one hand, openness, but as you point out, the rules for debating this repeal amendment don't have an opportunity for Democrats to participate. So are Republicans acting in good faith, in your view?
Well, they're not keeping their promises. I mean, number one, they said they wanted to deal with fiscal responsibility. And the Congressional Budget Office, which is the neutral umpire, says their repeal bill will cost $230 billion onto the deficit. And they're trying to simply wave that away as though that's, some unsupported opinion. So they're violating their own pledge, number one. Number two, they have a cut-go rule where if they have legislation that's going to cost money, they have to offset it by cutting elsewhere. They're disregarding that promise in this legislation. And number three, they're denying 65 of my colleagues the opportunity to have up or down votes on some of these specific provisions. So they're violating their own promise and assurance of an open Congress. So, yes, in 2 days, it's 3 broken promises.
But is this just politics? People break promises all the time, or are they acting in bad faith?
Well, I'm not going to say bad faith because I want to give us an opportunity to see if we can to work things out. What I'm concerned about is the consequences, the actual consequences. What does it mean to a family? And I've got these folks in Vermont. Their kid just got out of high school or college. They got an entry-level job, no health care. They're on that parent policy right now. The repeal means they're off. Folks with the pre-existing conditions, they're going to lose their access to health care. This is what I'm concerned about. How does this affect a family? How does it affect that kid who's getting started in the labor force? And how does this affect taxpayers if the first bill the Republican Congress passes is going to add $230 billion to the deficit? A lot of the stuff you watch and people throw their hands up, it is politics. Now, it has consequences, and that's what I'm really concerned about.
Let me ask you as a final question, Congressman, you were in power, now you're not. What does it feel like being back now under this new situation?
Well, I liked it the other way better.
But what's it like? I mean, the rooms are smaller, the position is different.
Well,
Was it that easy to change?
That's the least of it. I mean, when you're in the minority, you have a different job, but you have the same responsibility. And my view is that Democrats should be doing 2 things. One, whenever there's a way that we can work together with the Republican majority to get things done, to get a better energy policy, to have a sustainable budget, we should try to do it. We should work with them. But when they cross the line and do things that we sincerely believe are really bad for American families or American national security, then we should fight very hard and let the American people see what the differences are, because at the end of the day, it's their country and their future, and they've got to make the decision.
All right, Congressman, thank you so much for being with us. Have a good weekend.
Thank you.